Hey, this is Dr. David Myers. Hey, we got a cool case today. This gentleman's coming in and he's a wrestler. He gets his ears banged occasionally, but this time he really got it banged enough where he gathered some fluid. So if you let that fluid and this aggravation of the ear continue to happen, you can get what they call cauliflower ear. So this is how we avoid it. We drain the ear and of course going forward to protect it. So we'll show you how we drain this. And usually this is a seroma. We'll see what's in there. So you can see he's got a little collection of fluid there. What I'm going to try to do is just barely get a little bleb of lidocaine with epi underneath the skin where we can drain it. And that just helps with the tenderness here, as this is super tender. But the rest of the ear is normal. He just has that collection right there. So this is a 22 gauge. We basically just go in. And we'll see if we can get it out with this needle. If we can't, we have a bigger one available. And you can even see that draining coming out. That's the fluid in there. So it actually is not just a seroma, but a hematoma. And all that's just kind of draining out. And you can see that it's kind of got a color of like a red tinged. So actually it's kind of a mixture. We call that serosanguinous, part seroma, part hematoma. We can get it right out of there, or we just get it straight out of the source. So it's actually pretty large down in there. So this continues to as this continues to drain out, let's just enlarge this hole where we had the numbing. See if we can get more of this out. And my fingers seem to work the best. Totally full. Look how it looks now. So before and after, just a dramatic difference. That was just chock full. Let's keep getting a little tiny bit more. You doing okay?
Yeah.
Okay. Hang in there. A lot of people don't get how you get a cauliflower ear. What happens is you inflamed the cartilage in the ear, and as you heal, part of that normal cartilage is converted into almost like a scar tissue. And as this is repeated over and over, it stiffens, it becomes thicker, it even kind of deforms the regular contours of the ear. And so it's multiple repetitive trauma to the ear, and then subsequent healing is how you develop that kind of scar tissue. So look at this, it's back to normal. We really were able to get all of that, I'm going to call that serosanguinous fluid, out of that spot on the ear. And at some point we can kind of just call it good and put a little bandage and let you take off. But that should help a lot. Alright. Well, maybe not. We'll keep going. Yeah, there we go. That's probably pretty good. Wow. Look how gone that is. Okay. Fixed. Just like brand new. Well.